What to expect on the day of your operation? Well, before that day we'll have told you exactly what procedure you're having done, the type of anaesthesia, whether it's under local anaesthetic or under general anaesthetic. If it's under a local anaesthetic, of course, eat and drink freely, even if you've got any medical problems. If it's under general anaesthetic, we would like you to be starved from food for at least 6 hours before the operation, and you can have a glass of water up till 2 hours before the operation. On the day of the operation, please remove any rings from both hands, but certainly from the hand that we're operating, because your fingers may swell post-operatively and be very difficult to remove a ring post-operatively. Many of my patients have false nails. I don't mind you having your false nails. I'd rather you keep the false nails on, so I've got a nice shiny surface to clean, rather than a roughened surface that's often on the undersurface of acrylic nails once they've been removed. But with all nails, whether they're false or real nails, I really would appreciate some nail hygiene, just removing some of the dirt from underneath the nail prior to surgery. On the day of the surgery, you're walking through the main entrance of the hospital, give your name in at reception and they'll direct you to the relevant location. You may be having ambulatory surgery, so you may be sent to just a simple chair or a lazy boy type recovery chair. You may be admitted to a room, and we'll show you some videos later about the different types of accommodation that we can have. After the operation, I see all my patients, unless of course I've done the operation wide awake under local anaesthetic. I'll be discussing the type of surgery there, how well it went during the surgery, and of course you're free to look at the operation while I'm operating. Many of the private hospitals I work at now have a 4G camera with television screens around the operating theatre, and of course I encourage you to look at the operation if you feel that's appropriate. Some of my patients, however, are quite squeamish and really don't want to look, and of course we will turn the TV screens off and cover your arm so you can't see the operation. But we really think that it's important that you do engage with that operation, perhaps even look at the type of surgery I'm doing, because the rehabilitation starts right there at the time of the operation. And often my hand therapist will come to surgery and discuss that with you while I'm doing the surgery, what to expect over the next few weeks to months while you rehabilitate following the surgery.